Hello everyone, it's time to start. Welcome all to our Broad Cancer Day event, where we are uniting our voices and taking action according to the 2023 Broad Cancer Day theme. My name is Gertrud Eckert. I'm the Oncology Task Force Lead in PhRMA MEA, the Pharmaceutical Research and Manufacturers of America, and your moderator today. And before I'm going to introduce our esteemed panelists, a quick ask. We're looking forward to an interactive and engaging hour with you. So please comment and submit questions in our chat function. My colleague Marina is going to watch out for the content you want to share with us, and will make sure we are going to provide our answers. So let me now welcome our first two speakers, and I have to say co-hosts. It's Hannah Shar-Hui, and she's the member of the Board of Directors at the Union for International Cancer Control, UICC, and at the same time, she's the General Manager at the Children's Cancer Center in Lebanon. And together with Marina Al-Badr, she's the project coordinator and a strong pillar, I have to say, in bringing together like-minded experts and institutions to improve the delivery of cancer care in Middle East and Africa. Together, we've been organizing this event to not only present the main findings of the Personalised Cancer Care Report, but also create awareness for the upcoming 2023 World Cancer Day on February 4, Saturday this week. Hannah, let me start with you. Isn't it great to have all these international speakers with us today?
Yes, indeed. So good afternoon in our country to everyone. And I'd like to start by wishing all attendees a year full of happiness and health. I'm honestly very proud and honored to be representing both the UICC and PCCA, especially that we have only 3 more days for the World Cancer Day. So we're all looking forward to have for Saturday to be part of this singular initiative under which the entire world can unite together in the fight against cancer, a global cancer epidemic. It is indeed very evident that nothing happens without raising our voices high. And sometimes we have to remind people and even to repressurize them to shift the attention to the disease, especially with the high number of casualties worldwide. So when we have over 50% of newly diagnosed cancer patients who do not live to tell their stories, this is around 800,000 monthly, and 65% live in low to middle income countries. And this is what prompted the UICC, which is We all know the UICC, which is one of the oldest and largest cancer fighting organization globally, to come up with an effective and engaging and interactive campaign in 2022. That is the 3-year theme, Close the Care Gap. This gap that affects everyone, no matter where, when, and how. So in the past, this 3-year campaign aimed to highlight the importance of identifying the gaps, tackling them, and unifying our efforts and our voices to all of us together close the care gap. This powerful and enthusiastic theme, it is yet achievable if we all work together and make our voices heard. So we started last year in the first year of this campaign by focusing on realizing the problem. And this year, we cannot, but we have to unify our efforts to close the care gap. As member of the board of the directors at the UICC, we believe that by having more than 1,100 members across 171 countries, members of the UICC and more than 50 partners, including cancer organizations, foundations, and corporations, we need to unify our voices by collaborating all together. Around 1/3 of incidents are preventable today through vaccines, through support of scientific trials, researches, early detections, and many others. And this is what made us all together work and act, but we need to act very fast. The World Cancer Day has one objective: to prevent millions of deaths each year by raising awareness and education about cancer and pressing on governments and individuals around the world to take action against the disease. It was and so many tools have been provided and created, such as posters, press releases, samples, call for actions, and lately the 5K challenge to help participants and advocates to raise this awareness and as well leave an impact and tangible progress towards closing the care gap. We were very, very proud and that the last year's impact for the World Cancer Day in figures, it was like more than 375,000 social media posts. So this is a great thing in raising awareness. As it was mentioned by the US First Lady, as well as the British royal family and many other celebrities. And it was trending on Twitter as well, with more than 24,000 press articles in 160 countries, in addition to 980 events in 105 countries and 75 active governments, and the elimination of 324 landmarks across 30 countries. So World Cancer Day is not only to raise the awareness and shed the light on the day, it's a fight that we all had to achieve. It's a fight that we have to all ensure the proper diagnosis of the patient and treat them with the right treatment at the right time. So, and make their experience as good as possible for them, as good and smooth as possible for them. It's the call for action to prevent and educate about cancer. And this will yield the right outcome desired by reducing mortalities and increase cure rates, hopefully to reach the UN Agenda of 2030 targets of the SDG 3. So we all have to unite to build partnership and joint efforts. And we are aiming that this year to break last year's records of activities and hopefully with joining hands to transit into our last year of the campaign with confidence that we closed enough the care gap to offer and ensure the patients worldwide have a very smooth journey.
Hannah, there were so many points to touch upon, which would take us already an hour. Many thanks. It was really rich, and a call for action. I think already at the start of this webinar, you heard it. The ones on the call, follow, make noise. We should, of course, not only think of following the campaign on World Cancer Day, but throughout the year. But nevertheless, the time is now. So look it up. There are actions to take. World Cancer Day, Google, and you can find the link in the chat. Marina, perhaps we can put it on and really take some action, make some noise. It's on Saturday, and perhaps we can, as you say rightly, Hannah, improve a bit the rates and break the record we had already last year. You are in good company with princesses and the royal family. Go ahead and make some noise. You said it already rightly, last year's theme was realizing the problem, and I do remember we've been together exactly at this time and had the webinar as well, where we presented the IHE Cancer Care in Middle East report. It was a report looking into 9 countries in our region and building evidence of the delivery of cancer care. And Marina, you were with us, and I do remember we asked ourselves the question at the end of last year's webinar: what, if you could have a big wish, would have happened end of 2022? We have now beginning 23. Now we know better and we can have a look back, and perhaps this is something we should do quickly. What happened since last year? Marina, you were the part of the launch event. What has been achieved since then?
Thank you, Gertrude, and it's my pleasure to be within this esteemed panelist. So I want to highlight our contribution in the first year of the campaign, where we, as a PhRMA MEA, in collaboration with the Swedish Institute of Health for Health and Economic, the IHE, we hosted a virtual launch event to discuss the findings of the IHE policy report on cancer care in Middle East and Africa. So we had esteemed panelists, and we're following the theme of that year, which was the realizing the problem, and we discussed the growing cancer burden in the 9 Middle East and Africa countries. So cancer was and is still the second leading cause behind cardiovascular diseases. And we highlighted the inequalities in cancer care, in particular in the area of per capita healthcare spending, and how it was resulting in lives being unnecessarily lost. However, the future was not all bleak. So despite the expected rise in cancer care, the expected rise in cancer cases in the next 2 decades, our main researcher, Dr. Thomas Hofmacher, highlighted the demographic window of opportunity. So this window of opportunity comes from having a large percentage of population in the workforce. So this percentage will build a robust economy and use the tax revenue to build a resilient healthcare system and a better cancer care.
Yeah, that sounds incredible. I do remember we had on the panel also Professor Ahmed Abdelaziz from Egypt, and I do remember that he spoke about specifically, because Egypt being one of the scope countries of the report, do we have any update in the countries? Did we see anything meaningful throughout the years? Could you think of specific activities you witnessed?
Indeed, we have, Gertrude. So we didn't stop by launching the report in the World Cancer Day last year. In the contrary, we worked with our stakeholders, especially the experts who were involved in the report, and we had more than 30 stakeholders from the Middle East and Africa region, and we worked together to support the WHO drive for every country to create a national cancer control plan. These plans will help to reduce the number of cancer cases and death and improve the quality of the life of the patients. So you mentioned Egypt, Gertrude. In Egypt, our policy recommendation within the IHE report were aligned with the presidential campaign. It's about the women's health, and in particular for breast cancer treatment. So the presidential campaign is an initiative for early detection and treatment of breast cancer, and our policy recommendation were aligned with these recommendation, and it helped to strengthen and support this initiative. We had other webinars and other events in other countries, and I will highlight, for example, Algeria. So the IHE report results were the basis for discussion about the country's cancer care strategy and national cancer control plan. So the government there made a huge effort to improve the access to cancer treatment. And we actually will have within 2 days from now, we will have a summit. It's called the 6th Cancer Information Fair and Arab Summit for Alliance Against Cancer. It's the CCAN Summit, and we will present our findings from the IHE report. Other webinars that the PhRMA MEA Oncology Policy Task Force has been participated. It's in South Africa, where IHE recommendation has been the subject for discussion in a webinar called Investment in Cancer, Opportunities to Support Patient and Drive Economic Recovery. In Saudi Arabia, with the US and the Saudi Arabia Business Program, there were a session called The Future of Cancer Care. We were highlighting our IHE recommendations specifically for the Saudi Arabia. In UAE, we participated in the 5th GCC Combined Cancer Care Conference. And lastly, in Geneva, where we have been there with our main researcher, Dr. Thomas Hofmacher, and we participated in the UICC World Cancer Congress. We had a small session. It was initially small, but we had a huge participants from the UICC attendees. There was an interactive session to raise the patient voice in National Cancer Control Plan. So we hope to continue the momentum and build a great year this year.
It sounds, yeah, as if you had a very busy year, Marina, and I guess that it was not only busy, but fulfilling as well. And I'm fully aware that it was it sounds like huge steps already being taken up. And I think this is what Cancer Day campaign is about. If you agree, we must get involved any way we can, and together we can create this change. But together, I think, and this will lead already and be the segue to actually our next panel and our next to move forward in our session is to introduce the experts that are already impatiently waiting, and you can see them on the screen to join our panel. So let me now formally welcome Kavaldeep Semi. He is the CEO of the International Alliance of Patient Organizations, IAPO. Then I have Dr. Guy Phones. He is the head of the Global Coordination Mechanism on NCTs at the WHO, World Health Organization. And last but not least, of course, Abigail Ahmed. She is the PhRMA MEA Patient Engagement Group Coordinator and Lead. And it's a pleasure having you here with us at the World Cancer Day studio. This team, you will witness soon, is not the first time together. They have been collaborating closely in the past, and they're going to share with us how they united their voices and how they took action or are taking action fully in line with the 2023 World Cancer Day theme. And if you allow me, Kavaldeep, I would start with you, because one could think that the 2023 theme, Uniting Voices and Taking Action, was actually made for you. I know you since the World Cancer Congress in Geneva, and bringing people together and being active, that does describe you absolutely perfectly well. So can you share with us, Kavaldeep, what the Personalised Cancer Care Alliance is about, how it came about, and why do you find it so important in the EMRO region?
Okay, for a start, this is a great time to be within the cancer care field. The world is marking the 75th year of the WHO on 7th April this year. And that is 75 years of great work in cancer epidemiology, so forth. But now things are shifting. It's also a time where innovative cancer care diagnostic treatments and solutions are pouring in. I was just looking at some of the data that's come out of how many new cancer treatments have been registered over the decades. And guess what? The last 5 years has been more treatments have been registered than previous 20 years. So therefore, this year, I think we are now entering a phase when I think it may be the end of cancer as we know it, that it will no longer be the death sentence, as we have said previously, one. Secondly, it will no longer be the harsh treatment and the, painful experience patients go through. I mean, with immunotherapy, targeted therapy, some of the digital solutions that we get, pain management, etc., it will no longer be one of those experiences. And therefore, this time, it's very important that we take charge of this innovation, make sure it becomes a patient's right as in WHO's constitution, and make it part of our daily life. So the Personalized Cancer Care Alliance came about on these bases, that we were looking at, we were sitting almost like the people on the banks of River Nile or the Euphrates, and this innovation was flowing by us and we couldn't access it. So this is what it is. We want a share of this water. It's part of our right. It's our patient right. And what was also important was that whilst I was looking at this, never before has the AMRO generation, AMRO society been gifted with so many young genomic medicine experts. It's like it's a desert has bloomed. I mean, the people who are in oncology, the people, and they're the leading, the papers that are coming out the best. So Eastern Mediterranean region is in the right position. We have got local talent, local innovation, people who care. And to finally wrap the ribbon on it and this present, or put icing on this cake, Professor Dr. Mandari, who's the regional director of PhRMA, he last said in the middle of the pandemic where things were really bad on us, he said, this is cancer and cancer treatment is amana on our shoulders, that it's a generation like mine and yours who must make sure that we make sure cancer ends as we know it. It should no longer be a death sentence. It should no longer be the harsh treatment. It should not be destroying life. And we should treat cancer as if it's a common ailment and a chronic disease, and carry on our lives and build healthy personal lives and societies forward, and use the innovation that we have in our countries. Make sure we trigger this and build those. So it's a great time to be here, and this is why the Personalized Cancer Care is here. And just to wrap it on that, we went to a lot of patients, cancer patients in the region, experts, people who were, I call the giants upon whose shoulders we stood to look at the horizon. And they were all based in the region. We didn't have to go to the United States or Australia to look for that evidence. It was there, it was at the gems of the region. And they gave us a very positive outlook to the future, where they said, look, if you're looking at cancer care, we will now make it predictive, make sure our national cancer plans are really accurate with the data. We need up-to-date, accurate data, and we know what's the epidemiology, we know what's happening where and when, and be predictive where it would go. Then be preventative, make sure we've got solutions there to prevent it happening. The HPV vaccination, etc., catching cancer very early in the first stages. It shouldn't go to second stage even, the liquid biopsies and biomarkers that we have been proposing. And some of the experts, even Morocco and Tunisia and even Egypt, I heard a lot of pharma activity there, buyouts, new investment and things. We should be able to detect cancer at the earliest and then decide, do we go down the route of personalized cancer solution, genomic medicine, and treat with this immunotherapy and that, or would this cancer be more amenable to your conventional approaches? And lastly, I think what comes out is make cancer care participatory. And this is why we are uniting these voices today here. We should make cancer care participatory. We should direct this. It shouldn't be you're told a diagnosis and then there is, you become like almost an animal in a lab. It should be participatory. We should shape the healthcare ecosystem we need. And this is what the Personalized Cancer Care Alliance is in. We want to shape the cancer care ecosystem as we need it. That is symbiotic with our needs and families, understanding of our cultural needs, understanding of our gender, of our genomic medicine. There can be no other way to personalize it and make sure that we get the best for the best, and our right within the WHO's constitution is increased and strengthened over the next 75 years with these medicines. That's what our hope is. This is why we are uniting for voices. It's got clear-cut pathway, and it's a shining pathway.
Yeah, no, I mean, this is exactly touching on what the topic is about. And I think There's so much, again, rich content to share. And just for the audience, Kamaldeep was talking about the Personalised Cancer Care Alliance, the report. We're going to post the link where you can access this report in detail in the chat. And please feel free to ask questions and comment in the chat function as we go along. Many thanks, Kamaldeep. It was certainly some topics that are familiar with you, Hannah. You're not only a member of the UICC Board of Directors, you also lead the Children Cancer Center in Lebanon. And could you quickly share the local perspective on this United Voices and how to create a benefit from a coalition working together, taking action? Did you feel this on a local level as well, on the country level?
Now, we at the Children Cancer Center are very active, and we try to have, like, depending on the situation that we all suffer from every time. So we try to be as much as proactive. But what is needed from all the stakeholders now, and what really matters, is to have not only theoretical, but also ethical commitment towards the 5 Ps that were identified in the report. So the 5 Ps that are for cancer care health ecosystem, that is being predictive, preventive, participatory, personalized, and preemptive, as mentioned on many occasions in the paper. So at the Children Cancer Center, and to compare with our mission, values, and the sustainable goals, because we are committed to our SDGs, the 3, 5, and 17, and the services that we provide, it is in the core of our practice, and we are aligned with it. Now, clinically, our oncologists and in multidisciplinary team decide on the individual protocols that are personalized and patient target oriented. We are also educating and encouraging action for early detections, and we have launched the HPV vaccine, the HPV program in support of MSD and the CCA, and in support of and the childhood cancer awareness in support of UNICEF as well. So here it's a typical example of how these partnerships, they make a difference also. And for example, we are the initiator of the Lebanese Cancer Cooperation, which we launched in 2019, because we believe in this collaborative efforts and the results that could bring together and imply a progress for in the cancer community. So I see necessary to create this coalition and to act and implement its recommendation and best practices with the help of international institutions, definitely. However, on regional perspective and international ones too, it won't be easy. This coalition has to provide an added value to be able to overcome the challenges regionally and locally. But because these challenges may differ from one country to another, and some of the countries have financial challenges, others have governmental ones, cultural ones, and so this is different. So it's very important to here again to realize the problem and then to act quickly. But nevertheless, the extraordinary convergence of the medical knowledge, be it genomics, as was mentioned earlier, in addition to health technologies, data sciences, and so are transforming cancer care, as mentioned right now. And all this in addition to the continuous discussions that we always have, the seminars that we attend, the conferences. So all this international participation, whether it is the PCCA, the NCDA, UICC, SIOP, you mentioned them, are all very essential to the success in winning the war against cancer. I see the opportunity here for the region to be part of the discussion and to unify the best practices to reach the UN and improve to UNO goals and improve the lives of millions. It is our duty as patient advocates, as philanthropists, and scientists also, not to exclude ourselves from any productive or important discussion. To ensure that patients' highest attainable standard of health, and to fight for this one as one of the most fundamental, because it's one of the most fundamental rights for every human being, without the discrimination of race, religious, political belief, or any others. So the PCCA could be offering the benefit and the empowerment needed to raise this level of advocacy in the EMRO region, and that of course applies on CCL and other civil societies as well. We never exclude CCL from being part of this discussion, and mostly in our participation in the World Cancer Congress, also in last October, and the Patients Alliances, as well as the Autonomous Conference in Brussels and the CCI before that. All we need to, and we will continue not being part of ourselves, but also to encourage other institutions to take part of this, because it's only like with our collaborative efforts that we have to make this difference.
Yeah, I fully agree, and many things you lended the buoy, so to say, from the region to a country level, and I see, of course, sort of agreement already, but nevertheless, lots has to be done, and I think this motivational part of that the time is now does speak to the ones listening to us, and certainly to more collaboration on the broader level throughout the year and furthermore. Let me just address our next expert here, because there was so much, Dr. Phones, when we listened to Han and Kaval hearing about the work they've been doing and are doing in the region and locally to unite and listen to the patients and their needs. How does this connect to the WHO strategy surrounding people with the lived experience?
Thank you, Gertrude, and very much appreciate the invitation to the panel, and good day to all who are listening in virtually. Thank you for joining. Such a good question, but it absolutely not only connects with the work that I will give a bit more detail on, but the more important part is that it inspires and empowers ourselves as stakeholders, including WHO, to even do more. The great work that's being done at regional and country level has to then permeate to the global policy development cycle and the global discourse. So I think it's empowering evidence of the great work on the ground. And I'm happy also to say that we have been collaborating with those in the panel in different levels and connecting those priorities. To answer your question, maybe I'll come back to very important comments made by Kawaldeep and from Hannah, and it is about patient organizations and those with lived experience of health conditions in general, to shape health responses. So we're here listening of great examples of uniting and listening to patient voices. But we have the very clear priority at WHO and the team I lead is to take the next step. We unite, we convene, we listen, we respect, and then we use their expertise of lived experience of health conditions as data, as qualitative data, then to shape health responses, shape services, programs, and priorities. And we do it in a very conscious manner, elevating that expertise into the co-creation process at WHO. And you mentioned the strategy. We call it the framework for the meaningful engagement of lived experience of NCDs, mental health and neurological conditions. And that is exactly the purpose, is to understand how to operationalize, how to convene, how to listen respectfully in dignified manner, but also how to elevate those voices as expertise and bring them into the co-creation process at WHO. Very, very importantly, at WHO, we recognize the gap at WHO to meaningfully engage and co-create with patient voices and lived experience, but then also how to support our member states to the same. So it's a very, very multi-layered framework, which I'm happy to share elements in the chat or later. And we are already working with some of our partners and with regional and country offices to ensure that this then is contextualized, and this bottom up and top-down process are very, very fertile and healthy, and we're connecting with those voices early on in the development of this process. We need to create more resources, more evidence of the expertise of lived experience and how that can shape equitable responses. Anna, you mentioned the SDG agenda. We're a very few years away from meeting the ultimate goals across all the SDG, which is 2030. And we know very well, WHO and the community and the UN system and the broader community, that we're lagging behind on so many of those targets. And can we accelerate progress in the few years left to ensure that we meet those targets? Well, one of the main game changers, we think, is to really operationalize the lived experience of health conditions and the more, including the intersectionalities of those lived experience that include the social, political, economical determinants, gender perspectives, etc. How can we institutionalize that expertise into understanding why we are leaving some behind and who we are leaving behind, and how that expertise can shape those contextual responses that can pinpoint and can accelerate those responses on the ground? How can we transform those global commitments and action plans and frameworks into contextual, implementable, equitable, inclusive responses? The answer is meaningful engagement of patient organizations and lived experience, leveraging that broad expertise.
Many thanks. There were so many valuable points you made in this statement, and this would lead me to our next guest, or last, and closing the loop here. Of course, she's not last, but the last one just in the speaker's order. It's Abby. And Abby, question to you: how does this link with the work you were doing? What's the role when we speak of PhRMA MEA, of the industry, the joint industry, of course? Where do you see them?
Thank you, Gertrude. So the pharma industry that I'm part of and represent, we're global and international, and we have affiliates across the globe. And this allows us to kind of connect to stakeholders, to resources and initiatives from the different countries that have been successful, and to share those best practices and that knowledge within the region and beyond. But also as an industry, we work across the healthcare ecosystem, with patient organizations, with patients, caregivers, and also with healthcare professionals, scientific leaders, academia, and more. And with this, we're able to support the building of capabilities, education, cross-functional collaborations, and share our platforms with the aim to support the visibility and the recognition of that patient voice. Through PhRMA MEA, we have a patient engagement working group, and we were able to support the creation of the Personalised Cancer Care Alliance and support the educational webinars through this, and through the inclusion of scientific leaders and healthcare professionals who came in to present. They gave their time, and some of them also wrote opinion pieces that were embedded in the paper. That contribution matters, and we as an industry can facilitate that. Beyond that, PhRMA MEA also supports the creation of a patient advocate incubator. And this is something where it's a platform for learning. It's a platform for learning new capabilities, and it directly connects to the aim of strengthening patient advocacy within the healthcare system, that patient voice that Guy spoke about, the need to be together that Kawaldeep spoke about. So therefore, as an industry, we have quite a lot to offer, in my opinion, but that includes cross-border, cross-functional collaborations and learnings, platforms, education, and capability building. I think these are the areas where I see and experience the industry contribution.
Many thanks, Abby. And because I'm looping back now to what you've been studying, talking about, Dr. Funes, was you mentioned a few concrete examples, because Abby was already laddering down on this, and when I prepared for this moderation, I Googled the words WHO alignment and action, and imagine there were more than 8 billion links. So this is quite an impressive number, Dr. Funes. I think so that the WHO does already lots in this space, but if we could break it down now to 1, 2, 3 tangible examples, what would you come up with when it means WHO taking action? You mentioned before that there would be 1, 2 things you could mention, you can talk to us about.
Thank you, Gertrude. Taking action is really about WHO's function as the leading global public health agency. One of the core leadership functions for WHO is norms and standard setting. But another of the core issues is convening power. It has a powerful convening power that needs to be leveraged even further. And it needs to be leveraged to connect the layers of health system response, which is the global norm standard setting, with the regional dissemination and contextualization, with the country implementation level. And we need to connect those levels, and we need to convene the partners to connect, to help us connect those levels, and ensure that we, while building that very nice and very fruitful value chain, we are also incorporating bottom-up approaches. That is so important. And that is part of the DNA of the global coordination mechanism, where as a multi-stakeholder platform, we are ensuring that the voices of different constituencies at the local level are elevated to co-create these solutions and to contextualize and to design and co-design and co-lead some of these initiatives. In the GCM, we have many platforms. We convene youth, women and girls, lived experience, other marginalized and vulnerable settings, parliamentarians, policymakers, ensuring that this healthy environment of cross-fertilization can happen in benefit of country response, in benefit of what I was saying, identifying those pockets of underserved responses. Why are some of the services and programs and action plans not hitting the spot on the ground? That is the convening power that WHO has to understand. The NCD agenda, which the cancer control is very much part of, the broader NCD is a complex matrix of diseases, risk factors, and social, economic, commercial, and environmental determinants. That complex environment, we cannot address that from a health systems perspective only. We need to bring in the multiple partners across sectors at government level, but across stakeholders beyond government. And we need to understand the coordinated, coherent approach to do so. A critical, as I repeat, a critical partner there is the patient organization, the patient voice, and the patient expertise. So we have many platforms in which we are supporting this process, and the framework I mentioned is a critical underpinning technical norms and standard setting product that will ensure that coordination and that bottom-up approach.
Many thanks. There we see already the patient voice being really included in the work you're doing, and closing the gap doesn't always mean that it's the care gap only. It's sometimes really bringing together the right people to set up meaningful projects, and the structures behind that are, as you said, rightly very complex. We are already starting to run out of time. I'm so sorry to say that, but we've been talking now so much about these Personalised Cancer Care Alliance report. So Kamaldeep, 5 minutes, and I will be very strict in keeping the time now. 5 minutes, tell us the highlights of the Personalised Cancer Alliance report. And again, people, find the link in the chat. You can access the document there. Go ahead, Kamaldeep.
Yes, I think firstly, we must thank all the patients and experts who joined us in this. It's, as I said, a route map plan for the region, standing on the shoulders of some great giants. I would like to thank Dr. Sosan Almadi from UAE, who helped us really bring the whole report together, and she did a fantastic job of it, and charming everybody to contribute. And, you know, we have some of the best minds in the region. But we don't want this report to sit on our tables or hard drives in some folder. Please act upon it. Join us, join the Alliance, join in our program. We will be at the World Health Assembly in May at Geneva. We intend to hold a side event there where we want to bring this report to the WHO infrastructure and all the place. But also we want to have action locally. This will be in the GCC countries. Then we will be looking at Egypt, Morocco, Tunisia as the other. But we are not forgetting our brothers and sisters in countries where conflict, climate, and COVID has ravaged. We're including them as well in that action plan. For everybody, something is in this report. We want to make sure that we carry everybody in united voices. And please, 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 don't bring money into this debate. This is a time for all of humanity to invest in genomic medicine and personalized cancer care and precision oncology. Don't miss it. This is the most exciting time to be here. It's almost that time when Apple, Steve Jobs, who was a cancer patient, by the way, very good, used to be lovely on our programs, an excellent advocate. He said that when it's the Apple Mac moment, you know, when he brought this little machine and put it on the table, only those who saw what that could do, the visions they had, and the way it could be applied, won on the day. Please don't throw the baby with the bathwater. Let's put that money as a state, as a region, put that money in there. Let's invest in these technologies because they will be the ones that will reshape our cancer care ecosystem. And we need it now. And use your right to health. Mark the 75th anniversary of the WHO and pick out that constitution and show where your right to health is. Thank you.
Many thanks, Kamaldeep. And I feel now witnessing this moment with you here online, and I already took a screenshot of all of us, is something I'm going to tell my grandchildren. Once you make it already sort of moment in time history, and I feel it already, the excitement. So many thanks. It's perhaps time, Marina, that we have a quick look in our chat box. Is there anything coming in, people having questions? Or are they just so stunned listening to our expert panel that they are just silent? What's happening there? Anyone out?
Yeah, we have a quite interesting comments acknowledging the panelists speaking, initiatives, and the webinar as an overall. We have actually one question, maybe for the Dr. Fons for the WHO. How can the WHO support the MEA countries' advocacy around cancer implant is an investment, not a cost? And what are the needed steps to put prevention and early diagnosis at the core of the government plan? So for you, Dr. Fons.
Thank you. As I was maybe pointing in one of my comments with this very important value chain in WHO, which is 3-level. Global, we call headquarters global, connecting to the regional context, but with the intention of supporting then the different country representatives in each region. That value chain is very important for WHO, and it doesn't go in one way, in one direction, it goes in 2 directions. So we have very big ears on the ground through that value chain to understand how can we further support countries, what is required. We have many packages, we have advocacy campaigns, we have examples, we have best practices. We have that convening power, which is so important. We can take that to the ground. We can bring together countries, bring in the appropriate and very diverse and inclusive participants and stakeholders to have broader discussions. Please contact WHO through myself, through the team, through the regional office, the country office. We are ready to bring forth all of our very rich toolkit. The framework for meaningful engagement is a very powerful toolkit, and we have additional resources that can support that. But there's so many we can support on, and we are open to the requests.
Many thanks. Anyone wanting to give a quick statement on the question as well, back from Dr. Fons, who already, of course, gave a quite elaborate answer. Any other input? I mean, I do remember that the World Cancer Congress session where the patient voice in national cancer control planning gave quite some meaningful background and input. And I think this is something we are anyway experiencing here.
I could just add, you find that the WHO Africa, for a start, which covers part of North African countries, have already started a program to look at meaningful engagement of regional non-state actors and civil society organization patient groups. Please look at that accreditation program. Please participate in that, make sure you understand. We are also join us. We are trying to work with the WHO's AMRO region, making sure that the Eastern Mediterranean region, make sure that they have a similar accreditation process whereby you can then have a direct voice at the regional committee, a voice that can be combined with other voices, uniting with them. And if your governments are slow in taking some initiative, but when your voice comes independent from that, at that regional, then people do take notice. It's almost like having a wedding where you can bring in an additional support, and governments are really embarrassed if they're picked out. They said, you haven't done this, and an independent voice says, please do this. And it's a very unifying way of working together. And we would like to see you at that as well. The next WHO's regional committee will be inviting a lot of patient organizations. Thank you.
All right, I see already a lot of booking going on for Geneva in May, so I think you already promoted the session there. And the audience, we're going to share, of course, and WHO and IAPO and the Cancer Alliance certainly are going to be more visible, active, and we are following up with every side event or event you're going to plan there. You can certainly share via our social networks. And we have to come to an end. It's already time to close, and I don't want to do it in a rush. So if we look forward, because we've been looking back, we've been discussing the present. If we take out the crystal balls now, and I would start with you, Hannah, you look an experienced person to look into the future to me. Next time this year, what did we have? What do you think did we achieve throughout the year? But what happened? And the call is recorded, so we have to stick right to a sort of realistic background. No, you don't.
Yes, you want like for this year, for 2023.
What do you think?
No, what I can say quickly is that we're looking forward to see the cancer community raising the awareness more, pushing for action more with the same energy that we're seeing right here in the webinar. And it is with this transition from unifying the actions to close the care gap. In order to be able to reach next year, to be able to pressurize the governments, we need to focus on so many points. And this is why we at the Children Cancer Center, we focus more on the survivorship process, being themselves the advocates, the involvement of childhood cancer survivors in raising awareness. So this is very important because it makes the whole difference. We're looking more to more partnerships and the support of so many institutions, professional institutions like the WHO and so many others, and our partnership with MSDs and personally as a UICC board member responsible for the region, we look forward to more collaborations of these entities that will make the difference. So the involvement of whether it is the Children Cancer Center in Lebanon or the King Hussein Cancer Foundation in Jordan, whether it is the Friends of Cancer Patients in the UAE, I'm just naming quite quickly the cancer care, the Qatar Cancer Society also in Qatar. All of these institutions, if we unite in the region, we can reach we can have a proper roadmap in order for us to be able to meet, you just mentioned that we're lacking back in reaching the agenda for the UN in the 2030. So we have to really act so quickly in order and to pressurize our governments, despite the fact that the responses might be different from one country to another. But this is where we can only dream big, and working together, we will have our world free of at least some types of cancer.
Many thanks. I loved it, and dreaming big is certainly something that speaks as well to Kavaldeep, huh? Kavaldeep, active. On United Voices, dreaming big. I think these are words you can refer to, right? You can relate to.
Yes. I think this is what it really boils down to in the end. As you know, during the pandemic, we saw that the cancer programs were the first ones to be hit. And I can tell you, because as a cancer patient, also as an ex-cancer patient, supporting others in my community, we had real big problems, I tell you, and they're still lingering. We haven't started. And that's a wake-up call. I think we need to unite. And what happened was, it was through uniting whole of society, government, and even industry, as I said, PhRMA MEA, we found innovative solutions to address some of these cancer cases and make sure the treatment carries on. And therefore, it's only through uniting. I mean, let's celebrate. We just beat a once in a lifetime pandemic by uniting together.
Yeah.
It was not through being different to each other. And I think that's when, as they say, it's a kind of a biblical thing that the lion and the lamb must sit together sort of approach. We need to work that way. We can't treat differently, and the region itself must work collectively. Thank you.
Thanks, Kamaldeep. It was not the lion and the lamb that made me instantly think of you, Dr. Fornes, but more the role of WHO really as well. And I feel it more than ever going out and engaging, especially in this region, especially with the patient voice as you described. And it's something, I think, this momentum that came up, as you say rightly, Kamaldeep, stronger than ever after the pandemic. What would your sort of wish be for the 2023 to happen if we sit again in 24, say, looking back, this is what we've achieved? What would it be from your view?
I think we should have a robust solution for early diagnosis of cancer, which means I'm promoting biomarkers, liquid biopsies. You know, they should be standardized. They shouldn't be. Yeah. They should be like standard procedure. Yeah, best practice, because what they do is they identify those cancers at the earliest, and then we can decide about whether we need what treatment others. A small tumor can be addressed quickly. A cancer that's spread is difficult to deal. Yeah. And that's what we're losing. I think if you look at the dynamics of cancer, it's through lack of early detection and certainty of what this tumor is that is causing those high mortality rates.
Thanks, Kamaldeep. So let me just now get the wishes of the other two, Dr. Fornes and Abby. I would love to learn from you as well. What's on your wish list for 2023? Dr. Fornes, perhaps you would like to start.
Thank you. I'll try to be very brief, but I have two angles to this. One is very brief. What Kamaldeep, you have been mentioning about the vision for the next WHA and sort of maybe some opportunities for the World Health Assembly. But let me note that we're in the middle of the executive board at WHO. I'm in and out of some of the sessions. And what has permeated much of the discussion and some of the technical products that are being discussed is the meaningful engagement, the lived experience in some of these areas. So I think the movement has become very strong. The awareness, the visibility, and the value of meaningful engagement is there. But then I go to my second point, which is very clear, is the next step that I would like to see just in the next few months is how can we demonstrate that this has impact on health? So I would like to see that we all come together, those on the panel, our organizations, our partners, and those in the audience, we come together and develop a few projects that we take this that we demonstrate that the engaging lived experience of health conditions of cancer patients, engaging them in the co-creation of policies, as you say, Kamaldeep, we test it out, we engage, and we develop policies that have been co-created by lived experience, and they're implemented, and they're showing some change in screening, early diagnosis, that you mentioned. Let's test this out. Let's ensure the evidence is there to ensure that the meaningful engagement will have enhanced health outcomes.
Many thanks. There's no segue for me because I see Abby just nodding happily.
No, he basically stole my answer. He stole my answer. I basically wanted to say the same thing, that I think that what I would love to see if I'm sitting here next year, what I've seen is this collaboration between regional, global, and local. In the end, the change has to happen locally, and the local organizations need to get involved. And I think this kind of collaboration is a really good, pathway to follow up with these new relationships that you're building, that we're building as Alliance, and take it local. And I definitely hear in this session, I've heard from Dr. Guy Fornes, he's opened the door, he talks about what the WHO are doing. I saw some of the comments, and I think this is an invitation. It's an invitation to get involved, it's an invitation to reach out. And I believe that that door is open. There is a real want and an understanding that that lived experience has an influence in a patient experience, in a patient outcome, and that can influence healthcare decision-making. So for me, next year, I'd love to see a move in that, a connection regionally to local, and a movement in the meaningful engagement, that value of that voice being integrated into the healthcare decision-making process.
Many thanks. Marina, it sounds as if this year will be another busy year for you, and I hope that there will be lots of projects you can support with coordination and bringing people together and the power and the drive, but there's no lack of energy here. And I love this final statements of yours, bringing really sort of tangible will and tangible progress we want to see, not only in a year, but in the next few months happening with this. And we are really on time. I'm so proud of my own timekeeping capabilities. I have to say that it's time to come to an end. And I would like to thank all of you, esteemed speakers, and the discussion for the questions the audience having spent the 60 minutes with us and exchanged. And I would love to close with a statement I shamelessly copied from the Personalised Cancer Care Alliance report. Why not? Because it's a good report. Personalised medicine show us that not all cancers are the same, not all patients are the same, and therefore a one-size-fits-all cancer approach is not serving the patients or the society well. So personalised cancer care have the greatest application in cancer control and in the care, and we can transform and personalise the way in which and how fast cancer is detected, diagnosed, treated without disrupting lives and their families. So it's something we should keep in mind, working together, united voices. We see each other again this time next year. We're going to discuss the progress and what's on the agenda then next. Thanks for joining. Don't forget, World Cancer Day. It's Saturday. Join us, make some noise. Let's break the record to please Hannah. And thanks again, the audience, the speakers, for this lovely hour with you. Bye-bye.
Thank you.
Thank you for the great moderation. Thanks so much.
Thank you. Bye.
Thank you, panelists. Great to have
Thank you.
listen to you. Thanks.